So I had an interesting case of a 65-year-old female patient. She actually came in last month. Um, she moved from Ohio, has no past medical history other than what I'm going to say and tell you guys about right now. But anyway, long story short, she worked for a law firm for like 20, 30 years. And she moved from Ohio with her husband to retire. She hit 65. She decided to retire. It's time for her to enjoy her life. And her medical history really includes nothing but an appendectomy. She had a surgical history, I think 30, 40 years ago. She took out her appendix. And the last time she's seen a doctor was about 20 years ago. Now, when I asked her that, I'm like, why don't you go for your routine checkups, check your labs, see how you're doing? She said, I never really needed to. She had her kids and then she just stopped. She never went to a doctor. She was never sick. She smokes about half a pack of cigarettes for 40 plus years. And she's got no cardiovascular history in her family. Um, Her mother died when she was young. Her father took care of her and two her sisters. Long story short, there was nothing on this lady. She was sweet as hell, really nice. So I said, hey, listen, you've been smoking for a while. Let's do some blood work, okay? I know you don't like doctors. I know, you don't want to know anything about your labs. But I convinced her to a point. I said, listen, let's just do some quick workup, see how you're doing, make sure you have everything that you need, and then go enjoy your life, enjoy retirement. You can see me once a year if you don't want to come back every 6 months, for example. She agreed. I had to really convince her to get a CT scan of her chest, a low dose radiation CT scan I typically order in my smoker patients. She came back yesterday and after a 4 week follow up, and I got the CT scan results. Now, the CT scan results showed a left upper lobe mass. It didn't mention any metastasis other than the chest. So, for me, I said, I actually got the report a day before she came in. And I said, you know what, she's going to come in tomorrow. I'm going to talk to her about it, discuss her options. Her labs were fine. Her labs were completely fine. She had a little bit of elevated LDL. Her alk phos was also slightly elevated as well. White count was a little elevated, and her hemoglobin was slightly elevated. So, I mean, that's common in smokers. We see it a lot in smokers. Anyway, long story short, listen, everything kind of looks okay. We need to talk a little bit about your labs, but there's something else about the CT scan that I want to discuss. We found a mass. She gets up, says, I don't want to hear it. I'm like, okay, you don't want to hear the results? Nope, I don't want to hear it. Don't tell me. I'm like, okay, what about your labs? I don't want to hear, is there any, bad ones? I'm like, they're not bad. We just got to discuss a few things. And she's like, nope, I don't want to hear it. Is there anything else that you want to say, doc? I'm like, is there anything I could do to help? Is there anything I could do to make sure, you're taken care of? I don't want you upset and leaving and not coming back. She said, no, I'll see you back in a year. I'm not going to come back. She got up and left. She didn't want to hear the results. She didn't even check out with my front desk to make another appointment. What do you do in this situation where the patient is at risk of lung cancer with metastasis, most likely lung cancer, possibly an adenocarcinoma or a small cell carcinoma? High risk for metastasis. She continues to smoke, does not want to hear anything. Now, obviously, I respect that. That's what she wants. I will always do what my patients want. It does not matter. I will never force them to do any treatment. I will never force them to take any medications. How do you handle this situation where she does not want to know anything and she's at risk for cancer? Now, a lot on her SDQ, she added her husband that you can, call, tell for results, but she didn't want to know about it. So, do you tell the husband? Obviously, I'm not going to tell him anything because that's his wife. She didn't want to know. Why the hell would she want her husband to know? Obviously, because he's going to tell her. I'm worried about her. I'm really worried about her. And I don't know where to go from here. So, I don't know. What would you guys do? What would you guys do in this situation? It's difficult. I mean, I've run into some hard patients in the past and difficult patients, but not like this. I guess the only way would be to maybe just advise her to pick up her imaging, maybe a copy of her imaging in her labs, and have her decide on what she wants to do? What would you guys do? Let me know.